same time, one copy to the cerebellum for awareness. So this is awareness. And we have posterior spinal cerebellum, and we have anterior spinal cerebellum. This is very, very important. Okay, and so what's the meaning of proprioception? I mean, I don't know, we have in Arabic, hiss عميق.
Yes.
Hiss عميق. In Persian we say hiss عمقي, but in Arabic hiss عميق maybe is deep sensation. Is the body ability to transmit position sense. What does that mean? Means joint of position. We have JPS, joint position sense. JPS, joint position sense. When you sit here, the joint sends information to the cerebellum. Is proprioception. The muscle sends information is proprioception. The body's ability to transmit position sense, interpret the information, and respond consciously or unconsciously to stimulation through appropriate execution of posture. So, for correcting the posture, your posture, if your posture is not okay, if your posture is okay, for example, sends the good information to the cerebellum. So for execution of posture and correction, if there is any error, correction, the cerebellum is responsible. So if there is any error in the system, cerebellum can compensate, can correct. By your exercise, you educate the cerebellum in order to correct the errors in the movement. So, by spinal cerebellum, so correct the performance. One important thing, for cerebellum, please remember 5C. 5, maybe C. What is that? Please remember 5C. The first one, cerebellum, by C. Cerebellum, by C. 5C. Please remember 5C. Second, sometimes they say that the cerebellum is important for correction. Correction. If there is any error, the cerebellum can correct. 3. They say that one function of cerebellum is comparison. Comparison for what? Between the input from the periphery with the output from the cortex. Compare. If there is any problem, send some corrective information or correcting impulses to a spinal cord in order to correct. So they say that one function of cerebellum is for correction. One one is for comparison between the peripheral and central, and send some corrective responses for correcting the errors, if there is any error in the movement. So if you work on cerebellum, it means that and if you have some exercise for cerebellum, you have some exercise, good exercise for cerebellum, so you can do, you know that the cerebellum is also, the function is for correction and for comparison. Sometimes in calculation, when you calculate, if you have a good cerebellum, you can calculate, or in mathematics, they say that for calculation. In this case, I don't mean the mathematics. I mean sometimes you can calculate the distance. For example, please do this. if you for example the index finger of the patient, and I want to put the finger to this finger, the cerebellum can calculate the distance.
Yes.
Sometimes you have this metric means some disturbances in the metric to measure this metric. This is this metric. Now I am okay. If the patient is by itself. Just but when you do this, you have a good, you calculate the good measurement. This is dysmetric. Sometimes in some patients we have dysmetric. So calculation in this case doesn't mean the mathematical. Means to make some calculation. I mean for some calculation in order to have a good measurement. For example, so another thing is another test for cerebellum is FTN, finger to nose. The patient body. But when you have a good cerebellum and good tortoise, finger to nose. This is a test of. So another thing, if you have okay.
Oh.
This is okay. This is good.
Okay, yes.
But the patient has
reflux.
this is error.
Yes.
Because the cerebellum has no good function.
Fast reaction, but without
Fast reaction is very nice.
but without balance.
No, this is balance. Also, this is balance.
Yes.
A good balance of my cerebellum. You see?
Yeah.
Very nice balance. But the patient is such a thing. He cannot recognize this.
Right reaction, but bad balance.
Which one?
At the second.
This one?
Yes.
Yes. It's not good balance.
But good reaction.
No.
Why not?
Why
Can't move
do you say the good reaction? What is the good reaction? The good reaction is this.
They have to respond.
Respond, but this is the wrong response. The target is
The
here.
wrong way.
The target is here. If he can do this, as a good cerebral function.
So what about that exercise when you request from patient close their eyes and put in the right hand and left hand, this.
If this is
When
okay,
close eyes at the same
with close
Same
eyes,
way,
with
yes.
close eyes, okay, I close eyes.
at the same response, same way.
What do you mean? I don't understand.
Does it similar to this?
Yes.
To calculation?
This one? Yes.
Yeah.
Yes, when closing eyes.
Close eyes.
Yes, close eyes. Sometimes it's difficult. But most of the time, for tests, we ask with open eyes.
If the patient can't do that.
Cannot do
Try
this.
for 20 times, 25 times. Can't do that at the
It's
perfect
okay.
time. What that mean?
It means that the exercise is okay for correcting this. Yes.
Now, if they do that, false.
Was okay.
What that mean?
It means that maybe there is some problem in the pathway from the
With the open eye or closed eye?
with open. Open. You see this one. Finger to nose. If the patient does finger to nose, it's a good. What is that, for example? It means this method. Means error in calculation of metric. Okay, this is very important. Do you understand or no?
Yes, but I am
It's
also
important.
make research.
At the end, please come to me to
Yes.
explain for you.
Okay.
Okay, so correct performance. So the calculation, and also for another C is coordination. Coordination. So, except of cerebellum, which is by C, and then one C is correction, one C is comparison, one C is calculation or dysmetry, and one C is coordination. 5C. If you remember 5C, you mean that you remember the cerebellum. It's very important. Okay. And also the professor is kinesthesia. Sometimes the professor is means sense of movement. Sense of movement. You have a good sense of movement or kinesthesia. Kinesthesia is very important because some patient has this kinesthesia. They cannot estimate the movement, sense of movement. So due to some problems of the proprioceptions and send some error information to the cerebellum and to the brain, so you have you cannot calculate and you cannot estimate the good response. So sense of position is very important. Movement, sense of balance. These are very important. If you train the proprioceptions, it means that you develop the motor control and also when learning new skills. What does that mean, new skills? For example, you go for a sport and you learn new skills in that sport. This means that you have a good proprioception, and by repeating, you find some new skills. You see, some of the, for example, sportsmen are very skilled. I have no skill, but that sportsman has a lot of skills. It's very important. So that's related to cerebellum, proprioception, sense of movement. Okay. So and sometimes for your patient, after the damage, you must train the subject for new skills. And also it's important for some sportsmen. I will show you. So the agility, balance, coordination are controlled by proprioception. So balance and coordination are controlled by proprioception. So it means that the importance of proprioception is very, very important. And in physiotherapy and OT, occupational therapy, we need to know proprioception, to know the exercise of proprioception, to know the exercise of balance, and to know how to deal with imbalance. If there is an imbalance. Balance exercise is important, stretching exercise is important, coordinating exercise is important. Most of them are the same. Coordination exercise, balance exercise are the same. The exercise for equilibrium is the same. Is the same. Okay? So and most of the time in the neurological department, they have an occupational therapy sometimes department for occupational therapy. So you must be in contact with the neurosurgeon, with the neurologist, and to discuss with the neurologist for your patient. What's your opinion? My opinion is this, and then you can discuss. When can you discuss? When you have a lot of information. If you have no information, you cannot discuss. If you have information, you say, okay, what's your opinion? Okay, my opinion is this. I can give this exercise to my patient. All the time consult with your doctors, neurologist, neurosurgeon. It's very important. You see, you know that the medical neurologist, occupational therapists, physical therapists, nursing, all of them are responsible for the patient. You must discuss. If you have a lot of information, you can miss. If you have no information, you cannot miss. This is very important. Okay? So, for perception, muscle is important, joint receptor is important, continuous afferent is very important. These structures, GTO, MS, muscle spindle, joint receptors and cutaneous receptors are very, very important for perception. And by your exercise, you can activate muscle spindles, cutaneous receptors, GTO, and also joint receptors. Okay? So it's very, very important. So balance is important due to proprioception, proprioceptive retraining. Retraining is very important. So in balance, you need proprioception and retraining the proprioception. If you want to have a good balance, in cerebral dysfunction, you have no good balance. In brain stroke or in brain damage, you have no good balance. Okay? So you must have a protocol exercise, special exercise for the patients. And this is very important. You must have a program for them. I can do this. I can do this. I can recommend this exercise. I can recommend. This is very important. Okay? This is important. So this one, retraining. If you put the patient on uneven surface or unstable surface and say, oh, this is challenge the cerebellum and proprioception. But please support the patient. I mean, please be near the patient. Don't put the patient on the woman, on the rocker wall, on the unstable surface, and then go, okay, I want to go to have a tea. No, that patient may be fall, fracture. Most of the time you must be near the patient. And all the time look at the face of the patient. It's very important. So the patient has some dizzy, some vertigo, some dropping of blood pressure. So please be aware. At the time, please stop it, and the patient must go on a mat. Okay? In a supine position, be in up to a stable position. It's very important. It's very important. Don't leave your patient. Please be near your patient for any exercise. Remember, maybe there is some falling. Falling means equal to fracture. Okay? This is very important. So, but this one is very nice, okay? And you see the posterior column, dorsal column, spinocerebellar tract, and this is the meaning of the balance, by the ability to maintain equilibrium. Equilibrium is balance by controlling the body's center of gravity over its base of, you see, for example, the center of gravity is in the base of support, BOS. BOS means base of support here. But in the patient with cerebral, the base of support, there is a wide base, and the base of and the center of gravity is changed, and then maybe because they want to compensate for the balance. But this is not a good. Okay, you must have a good watching. Okay, so the balance is important. Most activities fundamental, influenced by SRH. So if you have a good muscles, good power, and input from the CNS, sometimes you must increase the power of the surgeon. And also sometimes, and as I told you, 3 different stimuli, visual and proprioceptive or somatic sensor is very important. Visual, somatosensory
Vestibular.
and vestibular. It's very important in balance. Okay, so this is also important. Here, what is this? This is a rocker board. This is a Hoover board. Okay, and you see a minimal squat and then do the exercise. It's very nice. And for this one, you see this patient. I don't know if it's a patient or not. A mini squat and then with a medicine ball to do the exercise. If you have a good coordination, you can do this. If you have not good coordination, you can't. This is stimulate the proprioception and sends a good information to the cerebellum. You can manage the cerebellum if there is any problem, or if there is any problem in the proprioception. Good correct information to the cerebellum, and also correct the errors in the. So this exercise is an example of balance exercise. With the medicine ball and this is very very difficult. It's semi squat and then do the any sports with medicine ball. Okay, this is very and this means that this section. When you do the patient on the, for example, rocker board, it means that perturbation. Perturbation. If, for example, is it possible from here from 1 minute? This is perturbation. For example, the patient is near you, and then please correct your balance, or please save your balance. This is perturbation, for example. And the patient is in the same position. This is perturbation. Some of the exercise is with perturbation in order to challenge the cerebellum to focus. So this is perturbation. This makes some perturbation. You see, it's perturbation. The goal and the aim is to correct, to affect on the cerebellum. Okay, so this is very important. If you start, well. Okay, 5 minutes. 5 minutes.
No problem.
And this is on skating. Very nice. Nice exercise. But this guy is a sportsman. It's very difficult for your patient. But this means that the balance, the meaning of balance. Very nice. And also this is the balance, ping pong. Ping pong. As you see some sportsmen. Very nice. Has a good balance, a good cerebellum. This is the nervous, and also motor. This is motor skills. In the upper limb, motor skills, and this is also for a musician. You know that one good exercise for the cerebellum is hand-eye movement. Hand-eye movement. Hand and eye movement. For example, to put some objects from here to here. To put these objects from here. This hand-eye movement. It's very important.
And that coordination.
Yes, coordination. Your skill movement. And sometimes for musician, for these violinces, they must have a good act on the music instrument. It's very important. That's related to cerebellum. Okay? So this is the skill, motor skill. Maybe in the first is not okay, but maybe after 10 years, very nice for some musician. This is very important, okay? Any sport. If you have a lot of tamarin exercise, you will be a good and you find the motor skills. And motor skills is the final stage of balance exercise. Final stage, motor skills, very nice. And here, as you see, the ping pong, very nice. And this slide summarizes all of the information. In one, sends information from the cortex to the spinal cord. At the same time, sends an information to the cerebellum. It's very nice slide. Very simple, but a nice slide. Motor cortex sends information to the spinal cord. At the same time, sends a copy of the commands to the cerebellum. From the anterior horses in the spinal cord, send information to the skeletal muscle. For what? For contraction. If you contract, it stimulates the afferents for perception. Sends information to cerebellum. At the same time, cerebellum sends some information to the cortex. I mean, the cortex, the brain, and the cerebellum are working with each other. Cortex sends information to the spinal cord, and then to the cerebellum. Cerebellum sends information. If there is any problem between these two information, from skeletal muscles and from the cortex to this, as I told you, the cerebellum can compare and send some corrective information to the spinal in order to correct the spinal cord for contraction. If there is any problem with the cerebellum, you have hypotony. Hypotonicity is the problem. And you see, this pathway sends information from the cerebellum to the red knuckles and then to the spinal cord. And this is very important. This slide summarizes all the information of neurophysiological for the function of cerebellum. It's very, very important. Okay? Any question? Any question? Any?
After
Who responsible for glands body?
But as I told you, cerebellum, proprioception. حس عميق. Proprioception means حس عميق. And the cerebellum and the cutaneous and also sends the information to the brain. Okay, it means that the brain knows about the stimulation. And after that, the brain can send some information by corticospinal tract to spinal cord and then to the muscles. Okay. At the same time, a copy of this information of the perception goes to the cerebellum. This means that cerebral awareness. Awareness means conscious. Do you know consciousness? In Arabic, maybe conscious. So we have after muscle spindle stimulation stage and the afferent fibers enter into the spinal, it divides into cellular, collateral, different collateral. Some of these collateral channels on the cell bodies of the neurons which ascend to the cerebellum. We have a spinocerebellar. Spino means spinal. Cerebellar means cerebellum. Means the passage is from spine, from the proprioception to the spinal to the cerebellum. So, by stretching exercise, by balance exercise, you stimulate the spinal cerebellum. If you know the neurophysiology, the exercise program, you understand very nice the exercise program. What's the reason of this exercise? And this makes you very happy. Because you know what are you doing. Please know what are you doing. What's the reason of this exercise? What's the reason of this exercise? Why do I choose this exercise? It's by neurophysiology. If you know neurophysiology, you can select the best exercise. It's such as to select the best medicine. There are a lot of medicines say that it. A lot of. Which one is okay for my problem? Maybe only one. That's important. There are a lot of medicines. Okay. Oh, I need this. But which one is selected? In your techniques, which exercise is selected? This exercise is okay for reception, for balance exercise. Because they stimulate the muscle sphincters. They stimulate the proprioception. They stimulate the brain. They make an awareness in the cerebellum. This is very important, okay? Please have a reason for your choosing your exercise. It's very important. Please have a reason, a cause. This is important because of this. This comes from the neurophysiology. If you know neurophysical, you know that. The tamarin or the exercise are very, very simple. What scientific story is behind this exercise? This exercise is important. If anybody asks you, or any other professors ask you, why do you choose this exercise? You must go, okay, this is, I choose this because of this. Reasons of neurophysiological reasons. It's very important. Okay?
Okay.
This is important. It's very important. So we have a spinocerebellar. A spinocerebellar is important. At all times, the cerebellum is aware of the state of stretch in the muscle. And this means that they can regulate the cerebellum, the tone of muscle. What is the tone? This is the tone. This is the tone. You see? This is the tone. If there is no tone, it's hypertone. If there is any problem for the cerebellum, you have hypertone. As I told you, hypertone is related to brain. And when damage to the brain, hypertone, spasticity, brain. But if you have hypotone, it's related to cerebellum. Hypotone. Muscles. Okay? Tone of muscles is reduced, not reduced. Okay? So cerebellum is very important. And you know that the effector alpha motor neuron, alpha motor neuron innervates the extrafusal fibers to produce force. As I told you previously, alpha motor neuron, we have two kinds of motor neuron, alpha and gamma. Alpha innervates the extrafusal muscle fiber to produce force. To produce force. And intrafusal muscle fibers are innervated by gamma motor neuron. And is related for stretching, and then when stimulate contraction of the intrafusal, and then stretch the muscles, sends information to the cerebellum. So gamma motor neuron can stimulate the muscle spindle. Remember, alpha is more diameter in comparison with gamma. Alpha motor neuron is very important, and gamma motor neuron. Two kinds of motor neuron. Gamma is related to stretch reflex. It's very important. Okay? These are the intrafusal muscle fibers. Okay? Gamma and if gamma motor neuron excited, can affect on the muscle skin. Muscle skin affect, sends information to the spinal cord, and then to the cerebellum, moche. Okay? And this, as you see here, this is the pathway of, you see, sometimes there are some anterior spinal cerebellum, and this is the posterior spinocerebellar, the spinocerebellar pathway is anterior and posterior, it sends information to the cerebellum in order to avail the cerebellum from the act, from the exercise, from the movement. So at all time, the mochech, the cerebellum is aware of the movement. This is very important. Why do you have a good balance? Because all the time the cerebellum has an awareness of a state of the muscles. Okay, this is very important. So the question is, spinocerebellar pathways are important for awareness. Spinocerebellar pathways are important for awareness. And it means that cerebellar awareness. This is very important. Look at here. This is the dorsal column, sends information, and this information sends information to the cerebellum for muscle coordination. Coordination means tawazun, means and adam tawazun means imbalance. We have adam tawazun.
Yes, yes.
Adam tawazun means imbalance. This is imbalance. When I have balance, means that balance, coordination, have a good coordination. Equilibrium is another name.
More balance, yes.
Balance, equilibrium,
Coordination.
tawazun in Arabic, ta'adul in Persian, and also
Coordination.
and coordination, or related to cerebellum, is very important. So we have posterior, we have anterior, and this is the dorsal column. So dorsal column is important. So spinal, remember spinocerebellar tract. It's very important. And also this slide shows you the spinal. You see, this is the muscle spindle, the muscle spindles, the spindle afferent fibers sends information to the spinal cord, and then one copy to the cerebellum. One copy